Wow, must be the start of spring.
Oh no, you're getting hay fever.
Yep, too much pollen in the air. Can you explain to me why I get hay fever?
Yes, did you know that hay fever is actually an allergic reaction?
Yeah, I knew that. But why an allergic reaction to pollen? Why allergies at all?
Well, that's actually a really good question. Did you know that allergic reactions are actually caused by your own immune system?
What? I thought our immune system was meant to protect us from viruses.
Well, you're actually correct.
Viruses like COVID-19 and the flu, as well as many other dangerous things like bacteria, parasites, and even cancer are all fought against by our immune system. However, unfortunately, in some instances, our immune system can also cause us harm. Immunologists call these situations hypersensitivities because they are the immune system being overly sensitive, resulting in reactions such as an allergy, even when they are not necessary.
So I get hay fever because my immune system's overly sensitive to pollen?
Exactly.
Well, that's so stupid. Why do we even have allergies?
Yes, it does seem silly, but while something has clearly gone wrong, it's also important to know that the immunological processes that cause your allergic reaction are actually there to protect you.
These are helminths, a type of parasite. They can be extremely dangerous and even deadly. If you were to be infected by one of these, then your immune system would fight it off using the same responses as when it comes into contact with an allergen such as pollen.
Well, I guess that's the payoff of having a strong immune system. It protects me, but then sometimes is overreacting to things.
Would you like me to explain how the allergic response works?
Sure.
Firstly, let's talk about allergens. An allergen is a type of antigen that causes an allergic response. Antigens are specific molecules that are recognized by the immune system. For example, the spike protein of COVID-19 or even a molecule from the cell wall of a bacteria are antigens. Pollen glycoproteins are allergens because they cause an allergic response when recognized by immune cells. Other common allergens include things that are breathed in or ingested, like mold, milk, dust, and peanuts, as well as things that come in contact with our skin, such as latex or components of lotions. So, as explained before, allergic reactions are a type of immune hypersensitivity. There are 4 types of immune hypersensitivities, but we're just going to talk about type 1, which is called immediate hypersensitivity because the reactions occur very quickly, or sometimes also IgE-mediated hypersensitivities because of the antibody type, IgE, that plays a crucial role in the response. You may have heard of antibodies before. Antibodies help us fight infections, and there are 5 different types. These are produced by a type of immune cell called the B lymphocyte. However, a lot happens in the development of an allergy before IgE antibodies are even produced. The first step is sensitization, which occurs before you even know of the allergy. Tissue-resident antigen-presenting cells, such as dendritic cells, come into contact with the allergen and engulf it. The DC then migrates to the lymph nodes and presents the allergen on a molecular marker called MHC to a naive T helper lymphocyte. It is called naive because it has never come into contact with an antigen. The naive T cell has a T cell receptor that is extremely specific to a particular antigen, in this case, the allergen. Allergen binding to the T cell receptor plus co-stimulatory molecules released by the dendritic cell cause the naive T cell to become activated. Cytokines such as interleukin-4 and interleukin-6 cause differentiation into Th2 and TFH cells, which will come back into play soon. Simultaneously, a naive B cell recognizes allergen via its B cell receptor or membrane-bound antibody and becomes activated. Now the T helper cells come back into play. The TFH cells release cytokines IFN-gamma and IL-4, which cause increased antibody production, and the Th2 cells release cytokines IL-4, which enhance isotype switching to IgE. Now we have a B cell that is producing lots of IgE antibodies specific to the allergen. The IgE antibodies have a high affinity for the Fc epsilon receptors found on a type of granulocyte called the mast cell and coat its surface. In this way, the mast cell is now primed to respond if it encounters the allergen again. This whole sensitization process takes place without any noticeable symptoms. Now let's see what happens upon re-exposure to the allergen. When the mast cell comes into contact with the allergen will cross-link bind to the surface IgE antibodies. This cross-linked binding signals the mast cell to release pro-inflammatory mediator molecules, which cause allergy symptoms. The major pro-inflammatory mediator is histamine. So how does this result in symptoms? Immediately after release of histamine, it binds to H1 receptors in various locations, causing contraction of the bronchi, leading to breathing difficulty, and increased blood vessel dilation and permeability, leading to edema, which is swelling, and urticaria, known as hives. Furthermore, IL-4 and mast cell mediators also induce the sweep and weep response, which gives you a runny nose and watery eyes. These responses are called early phase because they occur within minutes of exposure. There are also late phase reactions which occur 8 to 12 hours after exposure. Because of the cytokines and pro-inflammatory molecules released during the early phase, many immune cells such as Th2 cells, eosinophils, neutrophils, and even basophils, a type of granulocyte, flood to the site where the allergen is. The Th2 cells also release IL-5, which activates a granulocyte cell called the eosinophil. The eosinophil releases granules containing molecules that can harm your body. These molecules are perfect for fighting parasites but are harmful in this situation. This will occur even after the allergen is gone and results in prolonged swelling and damage to membranes.
Because our immune systems are adaptive and have memory, allergens that we come into contact with, once we have been sensitized to them, elicit an allergic response.
That's really interesting, but now I just have more questions.
I'm sure you do. Fire away.
Okay, but why pollen and why me? You've been exposed to pollen before and you don't have any allergies.
Well, that's actually really interesting.
It has been shown that you have an increased chance of developing an allergy due to environmental factors and also genetics. In 2015, scientists from the Johns Hopkins Asthma and Allergy Center published an article combining data from hundreds of genetic research articles to illustrate which genes are linked with allergic disease. Among many others, all of the human MHC genes called human leukocyte antigen have been linked to allergies via genome-wide association studies, or GWAS. MHC markers which are involved in allergen presentation are not identical between different people. In fact, they are the most highly polymorphic, or diverse, group of genes in the human genome. In other words, some people just possess MHC markers that are more inclined to present specific allergens than others. Furthermore, associations have been found between certain alleles of various genes encoding cytokines such as IL-33 and proteins like thymic stromal lymphopoietin. These genetic factors are why those with family members with allergies are significantly more likely to develop an allergy themselves. However, we must also take into account environmental factors. In a randomized trial of 620 infants who were known to be at risk of developing a peanut allergy, it was found that those who consumed peanuts were more than 10 times less likely to develop a peanut allergy than the infants who avoided peanut consumption. This supports the theory that tolerance and exposure plays a large role in the development of allergies. Furthermore, correlations have been made between a wide variety of environmental modifiers that have been shown to affect your chances of developing an allergy.
It's pretty much just a complex interplay of environmental and genetic factors.
Okay, so it's the environment's fault and my parents' fault. But what can be done? Can I ever be cured from my allergies?
Well, there are many forms of treatments, preventatives, and therapies available that are currently in use and are also being developed.
Firstly, antihistamines such as Claritine directly block the action of histamine. As you know, histamine is released by mast cells and immediately causes bronchoconstriction and increased blood vessel dilation and permeability. Therefore, antihistamines can prevent allergic symptoms. Secondly, the monoclonal antibody called omalizumab, or commonly sold under the name Xolair, functions by binding to the Fc region of IgE antibodies, thereby inhibiting the allergic response. In severe allergic reactions called anaphylaxis, the risk is fatal due to constricted airways and increased vascular permeability, which induces shock. The treatment for anaphylaxis is adrenaline via an EpiPen. Furthermore, while it is commonly accepted that allergies cannot be cured, their severity can sometimes be significantly reduced by immunotherapy. This form of treatment is often recommended in patients whose symptoms are not ameliorated by other methods. Essentially, you are given allergy shots, which train your body to become less sensitive to an allergen. It has been shown to be highly effective in multiple patients. Interestingly, many parents believe that limiting their children's exposure to allergens will help prevent them from allergic reactions. However, this is actually not advisable as exposure is necessary to develop tolerance to the allergen. For example, the Australian Society of Clinical Immunology and Allergy currently advises that babies be fed solid foods that are common allergens such as peanuts and eggs prior to 12 months of age.
Interesting.
So, overall, while it is frustrating having an allergy, it's important to realize that the immunological processes that cause your reactions are in some ways necessary for your health.
Ah.
And allergies are becoming increasingly manageable with the current treatment options.